More and more people are consuming anabolic steroids. Accelerating your physical transformation is very appealing, one know. Getting more with less effort is attention-grabbing. As you know, it has consequences, sometimes serious ones. Have you ever wondered how you can know, relying on science, whether someone is or is not a steroid user? And this is interesting not just for playing gym detectives, but also for health professionals or for anyone who is concerned about a friend or family member in their environment. In addition, indirectly, you will be training yourself in the desired and undesired effects of anabolic steroids and in the physiology of androgens. And obviously, the goal is not to judge or prosecute users, just as you don't do it with those who consume other drugs. The goal is to know more in order to act accordingly. And you might think that knowing whether someone uses or doesn't use is simple, but unless you have a well-trained eye, it's not at all. You would think that all users have this look, but no. Most steroid users look a lot more normal than you think, more like this. That's why it's important to know what changes occur in the body and in analytics and even personality when we take anabolic androgens at very high doses. Dr. Borja Bandera, an endocrinology and nutrition specialist, discusses 9 definitive changes caused by anabolic steroid use. Strength and muscle, great increase in a short time. The timing of the change is very important. Does anyone beyond the first 2 years of training increase their muscle mass by 10 kilograms in a year? Suspicious. And you'll say, Borja, what amount of muscle is reasonable to gain naturally in a year? Well, for an experienced athlete with more than 5 years of training under their belt, the so-called law of diminishing returns applies. The body has already reached a significant level of adaptation to training and the gains slowed down a lot. In fact, it's hard to gain more than 2 kilos of lean mass each year, and this is strictly adhering to the demanding lifestyle that is required. And the same thing happens with strength. Someone who has been squatting 150 kilos for 5 years suddenly lifts 200 kilos in a month and a half. Suspicious. This study published in the New England Journal of Medicine shows you how weightlifters with a year of experience, when they start taking steroids, gain about 60 kilos in their bench press and squat in just 10 weeks, 2.5 months. That's unthinkable in someone natural. Another clue regarding timing is that users stay in the same shape all year round, always maintaining a minimal fat percentage. This, naturally, is practically impossible, because your body responds to sustained caloric deficit with changes that you won't like. Your sleep will worsen, your sexual hormones will drop, and your mood will substantially deteriorate. How can you maintain a low body fat percentage all year round, always with chemical assistance? Fat-free mass index above 25. The fat-free mass index, or fat-free mass index in English, measures how much muscle you have for your height. It's a kind of body mass index for muscle and is calculated by dividing your fat-free mass by your height in square meters. To know it, you must know your percentage of fat and fat-free mass, so you have to previously do a bioimpedance or one of the methods one explained in this video. If you're curious, there are many free calculators available online. For example, mine is currently 22.5, which indicates that one have been training hard for many years. But even so, one will probably never exceed 25, since one would have to gain almost 8 kilos of muscle to do so. And that without high-dose drugs is complicated for someone who has been training for more than 15 years. In any case, a fat-free mass index above 25 should already put you on notice. In this study done on athletes, those who admitted to using drugs had an average fat-free mass index of 24.8, while those who were natural had an average of 21.8. Important things. Borja, are there natural athletes with an index above 25? Yes, but there are very few. They are usually genetic prodigies who have also optimized their training, nutrition, and rest for years. Like these, there aren't many. One repeat. However, this metric is dose-dependent. What do one mean? For someone who is 30, there is no doubt about the use. For someone who is 24, there may be doubts. There can be debate. Similarly, someone with an index below 20 likely has never strength trained. And on the other hand, there are also consumers with indices below 25 simply due to poor genetics or little training and dedication. Some people risk their health by taking this without training. Big and rocky shoulders and traps. The phenomenon of big traps and shoulders in steroid users has a very interesting physiological basis that you need to know. The deltoids, that is your shoulders and traps, are the muscles with the highest density of androgenic receptors in your body. These receptors are the ones that, when activated by their union with testosterone, become saturated and put your muscles to work to create new proteins and become bigger. This high density of receptors generates a differential and somewhat disproportionate hypertrophy. That is, it's the first thing that grows and what grows the most. In short, when you see titanic traps and shoulders, in the context of a less developed lower body, be suspicious. It combines in size, definition, and strength. If you stop to analyze it, it's very difficult to gain muscle hypertrophy and strength while maintaining a very low fat percentage. The first requires an energy surplus, and the second, the opposite, an energy deficit. Although internet figures like Anatoly have highlighted that you can be very strong without having a huge muscle mass, it's not common to combine size, definition, and strength. Except, of course, for steroid users. If there's one thing about drugs, it's that they work wonderfully to achieve what you intend to achieve, and they will keep you gaining muscle and losing fat at the same time, seeing brutal progress to which you become addicted and, without you realizing it, chaining you to a lifestyle that will take its toll in a few years. Gynecomastia. Gynecomastia is the growth of breast glandular tissue in males. It's a common problem at certain stages of life, but it's also closely associated with steroid use. This video explores the topic thoroughly. Up to half of users may develop this problem due to excessive aromatization of testosterone to estrogens. While mild cases are often well hidden by well-developed pectoral muscles, surgery is sometimes the only option. Shocking vascularization. What does someone unaccustomed notice when they see a consumer beyond the large muscle size? In the veins. What a piece of veins. It's a very common comment. Steroids not only have an anabolic effect on skeletal muscle, but also on internal organs and blood vessels, which increase in number and size, a process known as angiogenesis. Remember, androgenic receptors are present in nearly the entire body. Don't forget that androgens also increase blood volume and hematocrit, the content of those vessels, we could say. And this, along with the increase in muscle bellies, which push the superficial veins, and the low percentage of subcutaneous fat, gives that appearance to the venous circulation. More hair on the body, less on the head, and acne. Androgens are responsible for secondary sexual characteristics such as a deep voice, hair in male areas, or muscularity. When we give them in giant doses, side effects occur that, although not serious, can lead to suspicion of use. In severe acne, sebaceous glands near hair follicles are highly responsive to androgens, increasing sebum production. This almost always worsens pre-existing acne or causes new or initial acne to appear in someone who didn't have it. If suddenly, without other obvious life changes, your friend starts to look bigger while developing very severe acne outbreaks, something might be going on. Androgenic alopecia also accelerates a lot. If your friend who only had receding hairline becomes quite bald in a few months, those oversaturated androgen receptors are to blame. We all know the bodybuilder who never takes off his cap, not even at Sunday family dinners. Then there is a lot of body hair growth on the chest, beard, face, or back, although this is very easy to disguise with shaving. Changes in personality and mood. Steroids at high doses change personality. It represents one of the most evident and drastic changes due to the impact these substances have on brain neurochemistry. At the beginning, the consumer may feel euphoric and excessively active, a kind of hypomanic state. Feeling invincible is very common. I'm invincible and can accomplish anything. Taking unnecessary risks or even becoming arrogant. Some or individuals become very irritable and hostile with frequent outbursts of anger. Others have more difficulty controlling sexual impulses or any kind, and even give rise to other addictions such as alcohol or other drugs. This has a physiological justification as steroids modulate the reward areas in the brain. Over time, fluctuations in androgen levels lead to emotional highs and lows, that is, instability and more frequent moments of depression and anxiety. Up to a third of users develop psychological dependence on substances, which usually does not end well. If a loved one's personality changes suddenly along with physical changes, be cautious. 1. Invisible changes. By invisible changes, one mean everything that a health professional can see. In the analysis, in addition to the obvious change in testosterone levels, we would see suppressed LH and follicle-stimulating hormone, a very significant reduction in high-density lipoprotein cholesterol, an increase in low-density lipoprotein, an increase in estradiol, elevation of liver enzymes in oral steroids, and also polycythemia, an increase in the number of red blood cells, hemoglobin, and hematocrit. If we looked at the arteries, we would see greater development of atheroma plaques. And if we looked at the liver, heart, or kidneys, we would see organomegalies. What does this mean? An exacerbated and dysfunctional growth of the organs. Androgen receptors are present throughout the body. Blood pressure usually rises, and as for the immune system, there is a tendency towards immunosuppression, which generates susceptibility to infection. Do you think we've missed any important points? Leave it written in the comments so we all learn. Thanks for watching. See you next time. Hugs and keep empowering.